Thanks for being with us tonight. I'm Brandon Taylor.
And I'm Amber Noggle. In just about 2 weeks, May 11th, the national COVID-19 public health emergency ends.
State health officials are trying to get everyone ready for the changes that will bring.
Main message is that people need to take care of their health. They still need to be aware that COVID does exist in the United States. It exists in our communities.
The emergency is not a sign that COVID is going away, but what may go away: free tests and vaccines. A lot will depend on your insurance coverage. Now, hospitals are preparing for several regulatory and financial changes too.
New at 10, Caroline Dade has you covered on what the future looks like for hospitals in Madison and Monroe.
For more than 2 years, hospitals and healthcare workers had one focus: taking care of patients with COVID-19. But now things are different. People are still getting sick with the virus, but Jean Curran-Miley, the president of SSM Health's Monroe Hospital, says the number of COVID-19 patients isn't the same.
During the peak of the pandemic, as a rural healthcare provider, we had 12 patients in our med-surg and our ICU units every day.
Now, she says they often have only one. But UW Health's Chief Quality Officer, Dr. Jeff Potoff, says that doesn't mean everything is back to normal.
At UW Health, we have never had this many patients that wanted to come and get care from us before, and they've never been as sick as what they are right now.
Curran-Miley says the same is true for her hospital, as many people put off preventative care over the past 3 years.
They're coming in with level, stage 4 lung cancer, which is a much worse stage than saying if we caught it years ago at stage 1.
Both say as they move forward, they're taking 2 major lessons with them: the usefulness of telehealth and the ability to pivot quickly.
Instead of taking 9 months to make a change, we could do it in 24 hours.
Potoff says he's still not completely sure what the new normal is for healthcare.
Future for hospitals post-COVID will look different than what they were pre-COVID.
But he and Curran-Miley say they're proud of the work doctors, nurses, and other healthcare professionals did over the past 3 years.
Feeling pretty proud of what we got done, how we were able to take care of the community, kind of lead in that space, and that just feels really amazing.
Potoff says people across the healthcare industry are thinking about what did and didn't work well as they reacted to COVID-19. He says it's an effort to make sure response to the next pandemic, whenever it happens, goes more smoothly for everyone.
All right, Caroline, thank you. Now, the public